causes a syndrome called cytokine storm syndrome. इसमें बेसिकली क्या होता है कि हमारे पास दो टाइप्स होते हैं इसके, प्राइमरी HLH एंड सेकेंडरी HLH. प्राइमरी HLH इज़ अ जेनेटिक कॉज जिसमें परफोरिन और ग्रैन्यूल रिलीज ऐसे करके हम टेस्टिंग करते हैं. सेकेंडरी HLH जो होता है विच वी कॉमनली सी इन ICU सेटिंग is often, like I said, through autoimmunity like systemic onset GIA, lupus, Kawasaki disease, or it can be through malignancy like leukemias and lymphomas, or it can be commonly seen through infections like typhoid, dengue, EBV, CMV, etc. Now what happens is that to diagnose, when should you suspect HLH? You should suspect HLH when there is fever, falling counts and rising ferritin. Now serum ferritin is a very important marker. Now we do not need to do all the tests of the HLH 2004 जो आपके criteria, diagnostic criteria में होता है. That is usually meant for the primary HLH, but more commonly we see secondary HLH in our practice. So secondary HLH में what is important is that often you see a low fibrinogen or a low ESR, high triglycerides and high ferritin, and with the story of fever and infection. So ferritin more than 10,000 is quite classic of something called as macrophage activation syndrome or secondary HLH. Now what are the treatment options? Now normally we would treat this with either methylprednisolone pulse or with IV dexamethasone 10 mg per meter square per day. We can also add IVIG, we can add cyclosporin, but a beautiful drug for controlling HLH is something called as anakinra, which is IL-1 blockade. Unfortunately, it's not very easily accessible in India right now, but wherever we've used anakinra, it's worked beautifully well and it really saves lives. Now the issue is we have to keep checking serial ferritin levels to understand whether the child is improving or not, because जितना high ferritin होगा उतना poor prognosis या high mortality का risk. So you have to be very careful that you pick up HLH on time and start treating it on time.